Hello, my name is Dr Ruth Vine and I'm the Deputy Chief Medical Officer for Mental Health within the Department of Health and Aged Care. October is Mental Health Awareness Month. So I want to take this opportunity to encourage you all to think about your mental health, regardless of whether you've had a previous experience with mental ill health or not. It also gives us an opportunity to understand the importance of good mental health in our everyday lives and a reminder to seek help if you need it. This also coincides with World Mental Health Day on the 10th of October. In Australia, we're focusing on the theme of awareness, belonging and connection. So this week I want to talk to you about awareness. We're probably more aware of our mental health and ill health than ever. The perfect storm of COVID-19, pandemic measures associated with that, bushfires, the floods, certainly impacted many communities. This isn't subjective. The statistics back it up. The recent Australian Bureau of Statistics national study of mental health and wellbeing found more than 2 in 5 Australians experience a mental illness at some point in their life. More than 1 in 5 had experienced a mental health disorder in the previous year, with anxiety the most common illness. More than 1/3 of Australians were close to someone who had attempted or who had died by suicide, while 1 in 6 reported having had suicidal thoughts or behaviours. And these figures are even worse for people for some groups like First Nations, LGBTIQ+ communities, so clearly there is an urgent need to address this and try and turn the tide. The good news is that we do have great initiatives in Australia, like Are You OK Day and Beyond Blue, which support us to be more aware of our own mental health and the mental health of those around us. To start this month, I also want to acknowledge those who are not doing okay, those who are feeling down and a bit lost, and sometimes for any of us, we just find that we're not okay. Not feeling quite like yourself is a very reasonable response to some of the situations we've found ourselves in over the last few years. To help, we're boosting mental health awareness in schools and key industries and expanding access to suicide prevention services and training. We're also strengthening the focus on the social determinants of mental health and suicide prevention. Some of those include things like housing and homelessness, justice services, education, employment, social services, including disability and psychosocial supports. For more information, I encourage you to visit health.gov.au and head to health.gov.au. You can also visit lookafteryourmentalhealthaustralia.org.au for information and supports. Thanks for watching. I hope you can tune in next week as I'll be covering the theme of belonging. Thank you and goodbye.